when people used to call, it was, how much does my insurance cover?
Yep.
And that's an easy question, even though we're not in network.
Yeah.
But now it's, are you
Do
in
you
network?
take my insurance?
Yeah.
Yeah.
And so it doesn't matter that they still get coverage. It's that we're at a network, and so they're going somewhere else.
Sure.
So that's a really hard thing to compete with. So part of the value then of VAES is that you're exposed to techniques, procedures, and people that are doing amazing things in dentistry and medicine.
Sure.
And that allows me to be able to offer more to my patients than what a lot of other people can.
Sure. And I completely agree. I mean, in my office, my front desk is trained to first field that question and say, sure, we'll take your insurance. Where do you want us to take it? And just kind of diffuse it. And then really ask them a question. Why don't you tell me a little bit about your insurance? What do you know about your insurance? Because what we know about dental insurance is it's basically a rebate plan.
Yeah.
But the patient sees dental insurance, medical insurance in the same light. Unfortunately, that's just not the case, and we know it. We have to help our patients get into our practice, see the value, see what we do, and then kind of slowly turn the corner and say, you know what? I don't care what my insurance does. I love this place.
Right.
And that's kind of how we approach that. But dental insurance is definitely one of those first questions asked. And sometimes one thing I would add to that is a lot of patients call your office talking about dental insurance, and what they're really saying is, I'm scared.
Sure.
I got a lot going on in my mouth. I don't know what to do. I don't even know how to call a doctor's office, but I think this is what I'm supposed to say.
Yeah.
So I think being aware of that is helpful.
Yeah. You hit the nail on the head. It's an education battle.
Sure.
And that's not just for us. That's our entire staff that has to be able to have those difficult conversations, oftentimes long conversations, because it's more than just answering a question. It's answering a question and providing an education to try to help change someone's framework and thinking about their health and their mouth and all that goes into it.
So how do you do that? In your practice, I guess what I'm asking is, tell me about your new patient process, because that's where it all starts, right?
Yeah, it's really evolved a lot. So I've been in practice for 17 years now, and it's really fluctuated a lot from being extremely idealistic and probably turning a lot of people off to now being a little more picky about who gets those conversations. So it's kind of trying to...
But you're not talking about excluding people. It's more inclusionary, right?
Yeah, it's letting people know that this is available if they want to learn more. So I don't just jump into a lecture about why their insurance sucks and they need to come and see me because I'm so awesome. Yeah. It's that we can offer things that it sounds like they might want, but it's going to mean certain things that are different than what they're used to. And so if they're interested in that conversation, then we're prepared to go down that path. If they're not interested in that conversation, then we're letting them know that we're there when they're ready.